Ivan Melendez's days are heavy, filled with fighting a pandemic that plunged his community into despair. He rarely stops, except for this, his morning prayer. Today he's visiting 5 hospitals in Hidalgo County, where nearly 1,200 people have died from COVID-19.
How you doing, sir?
Edinburgh Regional Medical Centre has skillfully turned a corner, but no one wants to tempt fate.
I don't want to say this because I'm going to jinx you, but it looks pretty quiet.
When Texas reopened, they saw a surge in the sick in this heavily Hispanic area, and they had to rapidly adapt. This used to be a conference room, but it was converted into an intensive care unit, one of 5 in the hospital, and at the height of the pandemic it was packed with patients. Everyone here is being intubated and the chance of survival is very slim.
This whole room was filled to the brim of people everywhere. You would see people in body bags. The average length of time was 10 to 11 hours sometimes to get people out of that stretcher because the transport people couldn't come and pick them up.
What do you think's behind the improvement?
Here, our numbers are less because people are paying more attention. There hasn't been major holidays. People are using their face masks. And the last part, which I think is a sad commentary, is that a lot of our fragile people, myself alone, I've lost 12 people in the last month at the nursing homes. A lot of those folks that were barely hanging on, they've gone.
What do you think was the dynamic that created such a big problem here?
So if you're the number 1 or the number 2, in the entire United States, in obesity, number 1, diabetes, number 1, access to health care among the lowest, 40% of our people are underinsured or uninsured. I hate to use cliches, but you have a perfect storm.
Gustavo Ortiz has pneumonia from COVID and he's feeling the financial burden too. What do you say, Gustavo, to those people who don't believe coronavirus is still a threat?
Al contrario, yo ahorita ya puedo constatar de que es algo real y verdadero.
So he's testament that it is real and that, you know, that exists, that he's suffering from it. ¿Y tú eres una persona que dudaba? Were you one of the folks that doubted?
En un principio sí dudé, al principio.
He says he was one of those that doubted it.
The tide of death has started to shift. Juan Lopez says he's still moving up to 20 bodies a day though.
I've been dealing, for the past 6 months, I've been dealing 1,000 bodies. Lots of bodies, 1,000. You know, I lost count.
Where there isn't death, there's fear. A shrine, now a place to plea for protection. Here, faith and family are everything, but living close together has made many more vulnerable. Priscilla Garcia lost both her parents, Rolando and Yolanda, in just 4 days.
Since they both had COVID, we didn't get to have a funeral for them. It's really sad because it's not normal to go through that. To not be able to mourn your parents and then not be able to say goodbye to them either because of everything that's happening. It's really bad.
How does it feel now being in their home?
It's really hard because I have to see this every day.
Managing the grieving and the dead remains a problem. 2 weeks ago they had 108 COVID-19 victims here. Now it's 69.
It went from normal business one day to the next day knocking down walls because we don't know where we're going to keep everybody. It's just been extremely challenging.
What personal toll has it taken on you?
It's taken a huge personal toll. You know, I was telling my wife the other day, I didn't sign up to run bodies through a funeral home. I signed up to care for my community. You know, there's a lot of people out there that are talking about first responders. Right now there's a big movement, last responders.
Today Timothy is saying goodbye to his friend, Jorge Cabrera, a celebrated police officer killed by COVID. Everyone's been forced to mourn in a new way. in a country with more than 184,000 dead. Cordelia Lynch, Sky News, Hidalgo County, Texas.